Wellness Waves, a podcast by Fortis Healthcare to discuss health and wellness-related topics with nationally renowned experts from Fortis. Join us on this enlightening journey and ride the waves of wellness.
So what is the benefit for the patient from this approach?
This approach has several benefits to the patient. You can imagine that a surgical new approach is becoming so popular exponentially all over the world. That means only one thing, that it has got a lot to give to these patients. These patients benefit immensely from these kind of advantages rather than just technological advances on paper. What are the benefits these patients are going to get? The most important thing is this is a skin cut or a skin scar which is only about 8 to 9 centimeter. Whereas the traditional approaches will require about 16 to 22 centimeter incision, making it like less than half cut, less than half length of the scar on the skin. It is not just the cosmetically better scar. Making the scar or incision less also has lesser damage to the patient. Patient has less pain because it is a smaller operation, smaller surgery, smaller cut. Next benefit these patients are going to get is early mobilization. These patients can move early because their muscles are not touched. Another advantage these patients get immediately after the surgery is when they are lying down after the operation on the bed, they get pain from their scar if it is on the back of the hip joint. Whereas if the scar is on the front of the hip joint, they can easily and with very ease, they can lie down on the bed without pain. In fact, they can turn to the side also a little bit because the scar is not on the back of their hip where they are going to put pressure when they are lying down. Then other main advantage these patients have is a leg length equality. For example, after the surgery, one of the most common problem is a leg length discrepancy. In all studies, it has been shown that they get equal leg length left and right, whether you have done both sides together, because as I was telling you earlier, fluoroscopy or an X-ray can be done on operation table. Because they are lying down supine straight on the bed, the surgeon can measure the leg length properly, and also we can use a robotic technology to measure the leg length. With all these gadgets, with all these techniques, with the supine or a straight position, the leg length becomes equal. Next thing is after operation, you all may be aware that we'll have to cut through the tissue to reach the hip joint. If you do a side cut or a back cut, these patients can have limp because the muscles have been damaged. So the limp has been shown to be very good or not there in those patients who have direct anterior approach because their muscle is not damaged. There are several studies which have shown it very clearly that the patients who have direct anterior approach have early recovery and lesser limp, lesser dislocation, lesser leg length discrepancies, as well as many other benefits, especially in the first 6 to 12 weeks after surgery. Of course, the first 6 weeks and 12 weeks after surgery are very, very important for these patients during the recovery, because that is a time when we are all stressed out. That is a time when the patient has to go through a lot. That is why these approaches, because of their tremendous benefit in the early part of their surgery, have become exponentially popular all over the world.
Wow.